The goal of strengthening and improving the health of the Victorian Aboriginal community is complex and challenging. It is also a story of success and achievement. There are many different service providers, funding bodies, government departments and Aboriginal community groups all dedicated to the objective of improving health outcomes for Victorian Aboriginal men, women and children. In 2012, the Victorian Aboriginal Health Service was provided funding for 2 projects under the Victorian Government's Coolanballit program.
I'm Mary Belfrage, I'm the Medical Director at the Victorian Aboriginal Health Service. The funding that we received through Coolanballit has allowed us to strengthen and expand our services for children and families.
The objectives of Coolanballit identify key priority areas such as a healthy start to life, healthy childhood and transition to adulthood, addressing risk factors, and managing care better with effective services, with the overarching goal of improved health and well-being for Aboriginal people.
It starts with supporting healthy pregnancy and preparing and supporting adults to become parents and to be good parents. In the early years of life, it's about supporting and tracking development and also providing the programs like immunisation. So one of the key and absolutely important parts of VAHS and why it exists is that it provides health care and services in a setting that has deep cultural resonance for Aboriginal people. And most importantly, there are Aboriginal people and culturally informed ways of thinking and doing things that inform the model of services and care that we provide.
So I work alongside the speech therapist, and part of my role is just making sure that the room's culturally appropriate and just really breaking down the big languages from the speech therapist to the families, or to any clinician to the families.
The funding provided by Coolanballit has enabled the strengthening and extension of important and significant health programs at VAHS, particularly in response to the needs of families and children.
We've been able to establish a parenting program that we run through VAHS and with VAHS staff in partnership with mainstream parenting organisations. We've also been able to establish a speech service. We've been able to expand our capacity around specialist mental health clinicians for children and young people, and we've been able to expand our capacity around coordination of complex care for vulnerable children and families.
And we've always wanted to run programs for parents because a lot of the work we do is crisis work with individual kids, and what we really want to do is do preventative work to stop the problems developing in the first place. So we're running a program every term now, which we just didn't have the resources for before.
Initially I wasn't sure about the parenting program. I thought I was raised quite well, but my wife, being a social worker, had heard of a similar program and said it's one to have a look at. So I went along, and now I'm really happy that I went to the program.
We find that a lot of it isn't, the kids don't actually need counselling, the parents actually need help with how to parent, pretty much.
So parents are giving us really great feedback about it, just that they've been able to, they're getting new ideas, new perspectives, understanding their kids, feeling closer to their kids.
So what I got out of tuning into Teens program was I was able to learn about different strategies and techniques around talking to teens. I was able to meet other parents experiencing, challenging behaviours and difficulties with their teens. So yeah, I was able to yarn with them and talk about their experiences and also learn about the strategies that we could use.
endeavouring to ensure that funding continues for programs with proven effectiveness and a history of demonstrable measured improvement of outcomes, these Coolin Bartlett funded projects shine as an outstanding success story. Yet there is still so much that needs to be done.
It's very important for Koori parents to attend programs such as Tuning Into Teens. It's a chance for parents to sit together, talk about each other's experiences with their teens. You know, they can yarn through their experiences and brainstorm together and how to deal with it. Yeah, it's done in an Aboriginal organisation, so yeah, we know that it's safe straight away when we walk through the door because it's a Koori organ.
It is vital we safeguard their continuity into the future. For example, by ensuring the continuity of ongoing funding at a sufficiently early stage of the planning process.
With the funding that we have received through Coolin Bartlett, for example in the parenting program, we've been able to run 8 parenting programs in our first year. Got over 200 people have participated in those programs, and this is in contrast with the previous 5 or so years where we would have run 3 or 4 parenting programs.
It's been fantastic to see the increase, groundswell interest in the programs, both by staff and parents.
So parents are finding them really good and they don't want the groups to finish.
If these programs weren't available within the Aboriginal community, I think we'd go back to well, we don't have actual parenting experience. A lot of us weren't brought up by our parents who don't have those skills. So I think we will just go with what feels easiest, which will be the physical, punishment, and verbal punishment, which is not really going to help teach the child. They're just going to learn that behaviour or retaliate against those kind of things.
The alternative would be to go to mainstream parenting programs, and most of our parents just don't want to.
Because a lot of time parents come in feeling pretty, unhappy about the way they've been parenting and with a low self-esteem. And the great thing is about these groups is they're with other parents and they're able to share stories, and that's really validating, and it's great learning for them because they're helping one another.
And I guess the difficulty with a lot of these programs though is that this work really takes time, and to build that confidence and skills with Aboriginal staff and other staff who haven't necessarily had a lot of experience in that space. So beyond the life of the program, we'd really hope to be able to continue to build on that with support from further funding.
Now that we have it, hopefully it's like people will come in and learn those parenting skills, connecting through the community, and hopefully we'll regain that skill as a community and support each other.
Security of funding will ensure that the dedicated staff that run the schemes can plan effectively and know they have continuity of employment. The clients who have committed to participating in these programs will know that they can expect continuity of treatment and care, and the hard work that has gone into developing and implementing these programs will continue to bear fruit into the future.